So you've had a varicocele surgery before, right? You went through that anxiety of having varicocele surgery. You dealt with that incision, the stitches, and that pain and whatever complications happens after that. But now, after a few months or years, the same problem, the same headache has come back again, isn't it? Varicocele has returned. Hello, I am Dr. Nagateja Bonala. I am an interventional radiologist at Clinic 7 in Hyderabad. So today we need to talk about recurrent varicoceles. That is the varicoceles which come back after the surgery. If your varicocele surgery failed, you're not alone. More importantly, you do not necessarily need another painful surgery to fix it. First, let me tell you why a varicocele can come back after the bestest of the surgery. The varicocele coming back has a lot of reasons for it. It could be because of the lifestyle which you are following. It could be because of the disease per se. It could be because of the abnormal venous connections you have in your system. So there are many reasons to that, and don't always attribute it to surgical failure or something else. But these things happen when you don't actually understand that venous diseases can always come back in your life depending on the type of treatment and the type of lifestyle you are following after that treatment, right? So now your varicocele has come back, right? Now this is where interventional radiology offers a completely different approach. We use a procedure called embolization, that is varicocele embolization, working from the inside out, not from the outside. So using advanced imaging, what we do is we enter the vascular system through a very tiny pinhole in your leg or from the hand. We guide a very thin catheter directly into that faulty vein somewhere here. So directly into the faulty vein, we inject something called as a dye, that is a contrast, and we watch your entire venous system live on the screen, and we map out all the possible connections and drainage pathways of your varicocele. We can exactly see where the main problems are and easily spot those tiny hidden, even the collateral veins. Sometimes the surgery can miss, right? Now here is what makes our new approach very different and very effective. Once we identify that damaged veins, we use advanced medical glue and foam sclerotherapy to safely seal all those veins shut. We do not use any coils. This is a crucial advantage for our patients, because by using glue and foam instead of the metallic coils, we completely eliminate the danger of coil dislodging or migrating inside your body years down the line. You might have heard that, right? It is not very common, but this newer technique even removes that much of percentage of risk also. To ensure the most comprehensive treatment, we even perform scrotal vein sclerotherapy to tackle that complex local network right at the source, deep in the pelvis. So the blood naturally reroutes to healthy veins and the varicocele shrinks away. Recovery: there are no incisions, there are no stitches, there are no cuts, and it is done under local anesthesia. So you can simply walk out the very same day. And most men return to work within 24 to 48 hours. If you are dealing with recurrent varicocele and you want to have a alternate to surgery and also a coil-free experience, you can contact us. And it is more important to understand your condition properly before even going for any kind of treatment. So click the link in the description to reach out to our team at Clinic 7, and we are here to help you understand your options and provide a proper medical opinion so that you can make an informed decision for any sorts of treatment. Thank you for watching, and subscribe to our channel for more medical insights.